My name is Jeremy Kortmansky. I am the Deputy Chief Network Officer and a medical oncologist at our North Haven Care Center. I see multiple types of cancers, but I focus primarily in GI malignancies. I wanted to be a doctor since I was 5, when my grandmother sat me on her lap and said that she wanted a grandchild who was a doctor, and I was the only one good in science. But over the years, I really developed a strong interest in biology and chemistry, and I was drawn to oncology for a number of reasons. One certainly is personal experience. My mother died of breast cancer when I was a first-year medical student. I was always interested in the science behind it and how quickly the field was changing. And the more that I worked in the field, I realized how important the relationships are with the patients, and that really is what makes the difference every day, is that the relationship between an oncologist and their patients is the strongest in medicine. The advice I give to patients is that it's important to make sure we have all of the information that we need to make the right decisions, and that those decisions are made with a team to know that there's multiple eyes looking at their case. I think it's important for people to stay active, important for patients to remain social and really develop those relationships that are already around them, and then to take everything in moderation. It's very important to have a support group when you're going through this. I have often said that while a patient has cancer, it's a disease that affects the whole family. And so having that extra set of ears to hear what's going on, having an extra hand to hold while you're going through the process is really important. And it's important for others to know what you are going through so that they can be there for you. I focus primarily on clinical trials for patients with GI malignancies. I think it's an area where there is a really important need to get better therapies. I think patients want to feel better. I think they want to live longer, and there's certainly a lot of work to do. And every treatment that we have now has come from a clinical trial, and so it's important to continue to build on that work. What's important is that we work as a team, and that I am listening to your concerns and realize that the concerns aren't always just making cancer smaller or living longer, but enhancing the quality of life from day to day. And so it's important to know that not just me, but the whole team that I work with is geared towards listening to you and making that as possible as we can.